Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you've searched same-day HCG test near me, you're probably either verifying pregnancy, tracking a potential miscarriage, or monitoring after a medical procedure. The good news? Most labs now offer same-day results, but not all tests are equal, and costs vary wildly depending on where you go. Today, we're breaking down exactly how it works, what it costs, and the fastest way to get answers. Let's start with what you're actually testing for. According to Mayo Clinic and the NIH, HCG, human chorionic gonadotropin, is a hormone produced during pregnancy. It's detectable in blood as early as 6 to 8 days after ovulation, which is before a typical missed period. That's why HCG blood tests are the gold standard for early pregnancy confirmation. The test measures the exact amount of HCG in your system, which is why doctors order it, not just to say yes or no, but to track whether levels are rising normally. This matters clinically, and we'll talk about what those numbers mean in a bit. Here's the reality check. Most hospitals and major lab chains, Quest Diagnostics, LabCorp, and local hospital labs, can deliver results on the same day you test, but the timeline varies. If you walk in first thing in the morning, you might see results by early afternoon. If you go at 3 p.m., you're probably waiting until the next day. Some urgent care centers and fertility clinics promise 2 to 4 hours, but that costs more. The NIH notes that timing depends on lab volume and whether they're running tests on a batch or real-time basis. In general, don't assume same day unless you call ahead and confirm. Without insurance, a basic HCG blood test runs between $50 and $200, depending on where you go. Quest Diagnostics and LabCorp, through direct-to-consumer portals, typically charge $60 to $100. Hospital labs are often higher, $150 to $250, because you're paying facility fees on top of the test. Fertility clinics and urgent cares might charge $100 to $300 because they promise faster turnaround. If you have insurance, most plans cover an HCG test with a doctor's order, and you'd only pay your standard copay or lab work coinsurance. With insurance, expect $0 to $50 out of pocket. Online telehealth platforms that order the test for you usually charge $30 to $50 on top of their consultation fee. You have 3 paths. First, walk into a local Quest or LabCorp without an appointment. Order online, pick a time, show up. Second, use online telehealth. Order from home, the platform connects you with a nurse or doctor, and they issue an order to a nearby lab. You pick up the kit or go to the lab and test. Third, fertility clinics or OB offices if you're already a patient. The trade-off: local labs are fastest and cheapest if you're insured. Telehealth is convenient but adds a consultation fee. Clinics offer the most guidance but are priciest and require being a patient. None of them are wrong. It depends on your situation and timeline. You show up at the lab with your ID and insurance card, or just ID if you're paying out of pocket. A phlebotomist draws blood into a tube, labels it, and sends it downstairs or to the testing area. The blood gets processed using immunoassay, a technique that reacts to the HCG hormone in your blood and gives a quantitative number. This is why blood tests are more precise than urine tests. Mayo Clinic emphasizes that blood HCG levels can be measured very early, sometimes as early as 6 to 8 days after conception. Once the test is run, results go to a portal or your phone, usually within 24 hours, often within 4 to 8 hours if it's a priority lab. Here's what MedlinePlus and the NIH say. A negative HCG result is typically below 5 MIU/ml. A positive result is usually 25 MIU/ml or higher. but the number itself matters less than the trend. If your HCG is 50 today and 150 3 days later, that's normal and reassuring. The hormone is doubling as expected. If it's staying flat or dropping when it should be rising, that's a signal to discuss with your doctor. Your clinician might order a follow-up test in 48 hours to confirm the trend. This is not DIY diagnosis. These numbers are meant to guide a conversation with your doctor, not to confirm what the internet told you. According to the Cleveland Clinic, reasons to retest include bleeding or pain during early pregnancy, previous miscarriage, ectopic pregnancy risk, or fertility treatment monitoring. If your first test is negative but you still think you're pregnant, doctors usually retest 48 hours later because HCG levels double in early pregnancy. If they don't double, that's important clinical information. Don't rely on one test to make decisions. Your doctor should be the one ordering retests and interpreting trends. Also, certain medications and medical conditions can affect HCG levels, which is why telling your clinician about your full health history matters. Call the lab before you go. Ask if they run HCG tests in-house or send them out. In-house is faster. Go early in the day, before the lab gets backed up. If you're using an online service, read the reviews on turnaround time. Some promise 4 hours. Others take 24. Bring your insurance card and ID. If you're paying out of pocket, ask about any discounts they offer. Many labs have cash pay discounts. And if this is urgent, tell the lab staff. Sometimes they'll prioritize your sample for a small fee. None of these tricks replace good communication with your doctor, but they reduce waiting time. Same-day HCG testing is real, available, and affordable, whether you go local or online. Expect to pay $50 to $200. Get results in 4 to 24 hours. And always share those results with your doctor before making any decisions. Research from Mayo Clinic, the NIH, and MedlinePlus is clear. The test is a tool, not a verdict. It's a conversation starter with your clinician, not an endpoint. Now that you know how to order and what to expect, here's how to get started. Check the links in the description. They'll take you directly to Quest, LabCorp, and a few reputable telehealth options. You can order and schedule from your couch, pick your lab, pick your time, and get answers fast. Thanks for watching. What type of health tests are you interested in? Comment below and we will make a video about it.